And thank you. Thank you very much for joining us today and welcome. I'd like to start today by acknowledging the Aboriginal and Torres Strait Islander peoples of this nation and pay my respects to elders past, present and emerging. I'm joining today from the Gadigal land of the Eora Nation. So as mentioned, my name is Nadia Rosen. I'm the CEO of Head and Neck Cancer Australia, and I'm delighted to have you joining us for our 8th webinar. And I was just saying to our guest speakers today that I was looking at the stats of all of the recordings of our 8 webinars over the past couple of years, and they've had 5,000 views. So we record our webinars, they're available on our website and our YouTube channel, and they're very popular and people find them really valuable. So we did include a link to the physio and lymphedema webinar in the registration confirmation, and I encourage you to have a look at the other webinar recordings that we've got available as well. We couldn't deliver these educational webinars without the support and expertise of the head and neck cancer community, both our clinicians and our patients and family members. So today I'd really like to say a very special thank you to Dr. Matthew Wallen from Flinders University, to Anna Boffinger, who's a former patient from the Sunshine Coast, and Paul Mowbray, who is also a former patient from Wagga. We're really grateful for your time and your willingness to share your expertise and your lived experience. I'd also like to thank the J. Radisich Foundation in Western Australia, who very kindly have provided us with a grant to run these educational webinars, and we can't do that without the support of our community, so thank you very much. We're very lucky to have Kelly-Anne Jolly joining us again as our webinar host. Kelly has over 30 years experience as a leader in public health and health promotion, most recently as the CEO of the National Heart Foundation of Australia for Tasmania and Victoria. Kelly has her own lived experience of uterine cancer and is passionate about prevention and early detection. She's a strong advocate for community engagement and the need for organisations and services to actively listen and to respond to the voices of consumers to ensure quality care, which is something that we believe very strongly about at Head and Neck Cancer Australia. So we're really delighted to have Kelly host our webinar here again. So thanks, Kelly. I'm happy to hand over to you so we can get started.
Thanks so much, Nadia. I'm really delighted to be back again. I think this is my 2nd or 3rd webinar that I've been involved with head and neck cancer, and I always learn so much and are inspired by the people who have had this awful disease. So I would like to start too by acknowledging the traditional lands on which we are meeting here today. And for me, I'm on the land of the Wurundjeri people, the Kulin Nation in Melbourne. And I would like to acknowledge and pay my respects to elders past, present and emerging. Well, as Nadia welcomed you all, it's great that we have so many people registered for this webinar and that they are so popular. And of course, this one's no exception. It's a really important topic and perhaps one that's overlooked sometimes or not considered to be as important. So it's really good that this one has come up. And of course, it's really important for people across the board, pre-diagnosis, when you're diagnosed, people who are being treated, and also those living with head and neck cancers. So it really does cover the spectrum. So we, as Nadia said, we're really fortunate to have 3 great speakers bringing very different perspectives to this issue. Of course, Matthew, as we heard, and I'll introduce him a bit more later, brings his professional expertise as an exercise physiologist. And then we have Paul Mowbray, who brings his experience as a former patient. And then we're fortunate to have Anna, who's bringing a unique perspective as a professional and as someone who is a former patient as well, who's had lived experience. So you're in for a great session over the next hour. And I'm hoping that you will also pick up some really good practical tips and learn quite a few things along the way. But before we start, there's just a little bit of housekeeping and things I just want to go through. Firstly, I think we just want to be reminded of what we're dealing here with head and neck cancer. Every day, 14 people in Australia are diagnosed with a type of head and neck cancer. 14 people in Australia a day. And over 17,000 people diagnosed between 2013 and 2017 are living with the side effects of treatment. So that's a big number. And unfortunately, there are no screening tests for head and neck cancer. So early detection really does save lives. It's really key. And it can also mean less invasive treatment and faster recovery. So it's really critical that we do our bit as advocates and champions by helping to share our early detection messages with friends, family, workplaces, anywhere you can, to see that we can try and prevent where we can these cancers. The good news is, of course, that if it is found early, head and neck cancers are typically curable. So I think we've got to remember that as well. I just wanted to remind all of you that if you haven't participated in one of our webinars before, that we try and be as interactive as we can online. So please ask questions using the chat function throughout the webinar, and we will try and do our best to answer them. Some of them are going to not be able to be answered because they don't fall within the remit of our speakers, but we'll do our very best. Thanks to those who pre-submitted some questions, and we will be hopefully getting through most of those today as well. Please note also that we are unable to address any individual cases. So if you do have a personal question, we encourage you to contact your cancer care team or Cancer Council Australia on 131120. Now, we understand, as Nadia said, some people can't necessarily make it today, or something's cropped up and they weren't able to join us. So the webinar is recorded and will be shared on social media and at on the Hanker website in the next few days. And there's so many great resources on the website, which I've looked at myself. So you'll get a link to those and also the recording of the webinar. Just to remind people, if you are with us at the end, hopefully you will be, that there will be a webinar, a survey link will be sent at the end and will be emailed to everyone at the conclusion. So we really do appreciate your feedback to ensure that we're giving the best possible information and topics for you as part of this webinar series. We also have another webinar coming up in December, so stay tuned for information related to that. We're coming home strongly at the end of the year. All right, now that I've got all that housekeeping out the way, we will move to our speakers. So the format is really we're going to have our three speakers, and we may have some time after each speaker to have a few questions from people. So if you want to ask a question, pop it in the chat. And then we're going to have an opportunity at the end to bring our three speakers back and to cover any other questions that might crop up or questions that might be in the chat that we haven't actually addressed. So first of all today, I'm going to introduce our first speaker, who is Dr. Matthew Wallen from Adelaide, South Australia. And Matt is a Senior Research Fellow in Cancer Survivorship, the Deputy Lead of the Cancer Survivorship Program, and a Senior Lecturer in Exercise Science and Clinical Exercise Physiology at Flinders University. That's a mouthful, isn't it, Matthew? His main research area involves investigating the effects of exercise and lifestyle interventions in people living with and beyond cancer. And he's particularly interested in how lifestyle interventions can be utilised and implemented prior to treatment. So welcome, Matthew, and I'll hand to you.
Thank you, Nadia, and thank you, Kelly, for the wonderful introduction. I'll just share my screen really quickly. Hopefully everyone can see that. So thank you for the opportunity to come today and to present on I guess the importance of exercise and physical activity in the context for people living with head and neck cancer. So to commence with, given I'm located in Adelaide, I would like to acknowledge traditional custodians of land from where I am as the Kaurna people, and I'd like to first and foremost pay my respects to elders past, present, and emerging. So hopefully by the end of today, I'll be able to provide an overview of what physical activity and exercise is and why it's important for general health for people living with cancer, and as well as specifically for those people living with and beyond head and neck cancer. I'll outline the current physical activity recommendations and how this relates to cancer, and narrow down considerations for people with head and neck cancer. And finally, I thought it would be nice to provide a de-identified case study where exercise is individualized to a person with head and neck cancer. So I guess first and foremost, it's important to define what physical activity is. And you'll see here by definition, physical activity is characterized by any bodily movement produced by skeletal muscle that results in energy expenditure, and in recent updates by the World Health Organization produces health benefits. However, it's also been proposed that we should perhaps look at how we reframe physical activity and how we describe it. And a new term was recently proposed, which provides, I guess, a more holistic overview of what physical activity really entails, and goes on to describe about how it's more about moving, acting, and performing within culturally specific spaces and contexts, which are influenced by people's interests, their emotions, ideas, instructions, and of course, their relationships. So really, exercise and physical activity are linked together. But I guess it's important to think about physical activity as the umbrella term, and then it's divided into two main components. The first component is being structured, which is where physical activity is planned, purposeful, and aimed to promote health and fitness, which is where exercise, including aerobic and resistance training, falls into this category. The other side of the coin is incidental physical activity or unstructured physical activity, which is not planned and mainly revolves around activities that are embedded into day-to-day living. So it's also important to provide some context around, why exercise and physical activity is important in the context of head and neck cancer. Now, as we know, there's certainly many risk factors for developing head and neck cancer. However, there's also evidence to show that higher levels of physical activity might reduce the risk of developing head and neck cancer by about 15%. And in people living with head and neck cancer, the inverse is also true, in that there's a lack of physical activity is actually a risk factor for a reduction in overall longevity. So collectively, there does seem to be a link between physical activity or lack of physical activity and the risk of developing head and neck cancer, as well as life expectancy. Fortunately, though, we know that physical activity and exercise is modifiable, so we can do something about it. And it's very clear that if you engage with exercise on a regular basis, there's a lot of benefits towards your overall health and well-being. And we were chatting before the webinar sort of started, and someone stole my thunder about what I was going to talk about. But I think Professor Prue Cormie, who's a prominent researcher in Melbourne, in exercise physiologist in cancer care, put it really nicely in a talk a number of years ago, that if we could put the benefits associated with exercise into a pill, it would be demanded by all people living with and beyond cancer, prescribed by every cancer specialist, and subsidized by government. For example, the multitude of benefits, well, there are a multitude of benefits for people living with cancer, and these include some of the examples, and really there's more that extend beyond this, but there's whole body benefits such as increasing your overall level of fitness or your cardiorespiratory fitness, improving your ability to walk, so with exercise capacity, positive changes in body composition as well, such as a reduction in body fat, and also increases in overall bone health. We know that exercise is a potent stimulus to improve bone health. There's muscle-specific benefits, such as improvements in your overall muscle strength, as well as muscle size, which is really important, particularly in the context that people are going to go through treatment and there may be reductions in muscle associated with treatment. There's systemic benefits as well in a variety of metabolic functions within the body that are captured when we sample your blood, such as reductions in your blood sugar, improvements in your cholesterol, and reductions in some markers of inflammation. And finally, I guess one of the things that's really coming to the front is the real effect that exercise and physical activity has to reduce overall fatigue and cancer-related fatigue, reduce the likelihood of developing depression and anxiety, as well as being embedded into the management of these conditions, and as well as improves overall health-related quality of life. So there's a vast majority of benefits associated with exercise, and this is why I'm quite passionate about it. But importantly, these benefits really extend across the whole cancer continuum. So for example, if you look at the figure here going from left to right of the screen, the benefits of engaging in physical activity and exercise help reduce the likelihood of developing cancer, may enhance the tolerance and treatment, and minimize the related side effects associated with treatment. It may also reduce the likelihood of cancer recurrence and long-term side effects after the treatment is finished. Specific to people living with head and neck cancer, I wanted to provide some snapshots of what the current evidence says for exercise and physical activity. And I've divided this into before treatment, during treatment, and also after treatment. But to contextualize it, it's important to acknowledge from the outset that the majority of exercise research has tended to focus on cancers such as breast cancer and prostate cancer, as well as bowel cancers. And however, what we are starting to see is that more and more research is starting to accumulate in head and neck cancer. And it's really highlighting why engaging in exercise and physical activity on a regular basis is so important. That being said, the evidence that I'll present here is quite small numbers. However, I'm very aware that there's a number of ongoing studies now aiming to recruit a lot more people to these exercise trials. So hopefully, if we do a presentation again in another couple of years, there'll be a bit more conclusive evidence in the future. So to start with, if someone has been diagnosed with head and neck cancer, there's a finite time period where this concept of preparing for treatment with exercise and other lifestyle interventions may be useful. And this concept of preparing for treatment has been coined prehabilitation, as opposed to the more common term rehabilitation, which typically happens after treatment. And the clinical goals associated with prehabilitation are really around optimizing pre-existing impairments, such as improving physical function and minimizing comorbidities, improve physical health and to safely complete treatment, so being fit for treatment, and establish a baseline to prevent side effects or potential side effects associated with treatment. And to represent this in a figure, essentially the purpose is trying to improve your physical function and capacity prior to treatment, with the intention that this might reduce the likelihood that you'll experience significant treatment-related side effects, and you may tolerate the treatment better. Now, it's important to acknowledge as well is that this prehabilitation concept has primarily been focused in the surgical setting, but there is now emerging evidence starting to see whether it might be applied to other treatments, such as radiotherapy, which I know they're starting to do at the Peter MacCallum Centre, which is wonderful to see. In the context of head and neck cancer, there's been some research which has shown that people with head and neck cancer feel that prehabilitation is important to prepare for surgery and to maintain a healthy lifestyle. And that it might be, I guess, helpful they feel better and physically and mentally leading up to the treatment. And certainly when we can translate evidence from other cohorts where exercise prehabilitation has been used effectively, particularly around engaging with targeted exercise to improve overall fitness, physical function, and muscle strength and size. However, in this context, there's limited studies around specifically aerobic and resistance training in this context. And the majority of the overall evidence tends to focus around swallowing specific exercises and minimizing locked jaw and trying to improve around the jaw area and the muscles around that, which is primarily addressed by engaging with a qualified physical therapist, physiotherapist, or speech pathologist with experience in these particular areas. When we move to during treatment, the emphasis shifts slightly. The goals tend to focus around minimizing preventing side effects and symptoms related to treatment, monitoring to see if there's any changes in initial impairments, and to assist in tolerance of treatment. Now, the research in this area, I'm pleased to say, is stronger, and there's been several studies that have shown that aerobic and resistance training is safe and feasible in people living with head and neck cancer, undergoing chemotherapy and radiotherapy. And certainly these studies have collectively shown that exercise typically uses a combination of aerobic and resistance training can improve outcomes such as your exercise capacity, muscle strength, and improvements in muscle size, health-related quality of life, as well as improvements in fatigue. And it's important as well that not only we tend to see improvements, but we also see a positive thing where there's no changes, which is a good thing, particularly given that people typically experience reductions in a lot of these outcomes during treatment. So if we can minimize the impact that treatment has, that's a positive thing. What's really interesting is that they've been conducted in a hospital and a home-based setting, which, depending on where you live and access to facilities and your overall health and treatment schedule, it might be useful to overcome participation barriers with regular exercise. After treatment, the goals tend to shift a little bit more again, but overall there's a focus on restoring function that's been lost during treatment, and trying to minimize side effects and long-term effects, and assisting to return back to prior function and get to new levels in terms of physical function. Now, the evidence in this area is used strategies like aerobic exercise, but primarily the focus today has actually been on resistance training. And you can imagine there's also a focus on shoulder and neck mobility, particularly after treatments that may have impacted upon strength and physical function around those areas. But what I can say from the evidence is that there's improvements in shoulder range of motion, overall fatigue, pain, levels of fitness and exercise capacity, strength, and health-related quality of life. So you can appreciate that a lot of the benefits we're seeing really extend along the whole cancer continuum, which is amazing. But now that I've sort of contextualized what the benefits are of physical activity and exercise in this cohort, I want to sort of paint a picture about what the guidelines say around engaging in exercise and regular physical activity. So I assume most people have some awareness of 150 minutes of moderate physical activity, and in Australia they are the guidelines that people should be aiming to achieve over 150 minutes of moderate intensity exercise or physical activity per week, or over 75 minutes of exercise at a more vigorous intensity, or even a combination of the two will suffice. However, I really want to point out to people that there's often a missed guideline as part of this, and it's really that adults should be engaging in strength training at least twice per week on non-consecutive days. So not only do we have a benefit on our cardiorespiratory fitness, where we see the improvements from moderate physical activity, but we're doing dedicated resistance training, which is important for our overall health. Now, 150 minutes might seem like a lot, particularly if it's been a while since you've done exercise, or you're looking to get back in your exercise, or you've taken time away for treatment. But it's important to start off at an intensity that you feel comfortable at and can maintain, and regularly adhere towards over time, and gradually build this up over a period of weeks and months to eventually meet these physical activity guidelines. But if there's two main points that I want people to, take away from today, is that the first one being, doing some physical activity is better than doing no physical activity. And that there's no holy grail of exercise. We know certain exercises impact body systems differently, but really the best exercise is one that you can do and that you enjoy, and that you'll engage with on a regular basis and incorporate into your day-to-day life for the rest of your life. It's also important to acknowledge that there have been several position statements, which is amazing, that are now regarding the importance and highlighting the importance of exercise in cancer care and management. And the papers that I've done a quick screenshot of and pasted into the PowerPoint are fantastic resources about how exercise and physical activity can be prescribed. I will, full disclosure, warn you though that some of them are quite long and quite technical. So it's certainly something if you're looking for a late night read, but hopefully I'll be able to summarize everything together in the next few minutes. But I guess while the collective advice and recommendations of these statements and guidelines are generally quite similar, it's important to recognise that while they're a useful resource, exercise and physical activity shouldn't be a one-size-fits-all approach, and that this really should be individualised as much as possible. So guidelines are fantastic, but really the individual prescription is absolutely key. And I'm going to talk through some of the ways in which we prescribe exercise and the tools that we use to do this. So what we've currently got here, the nuts and bolts of exercise prescription. I guess there's a few main categories or levers that we use to try and alter the amount of exercise or physical activity that someone gets. And you may have talked or heard about these before in the past, but I'm going to quickly go through them. So we have the frequency, so how often you're doing exercise, the intensity, how hard you're doing exercise, the time dedicated towards how much exercise you're doing, the type of exercise that you're doing. So things like whether you're going for a run, whether you're going for a walk, whether you're doing strength training. There are two additional ones which has come into fruition. And so that's one of them being overall volume of exercise. So if we multiply the frequency, the intensity, and the time together, that creates the overall volume that someone's doing. And also progression. So as you've probably heard in the past, if you're doing the same thing over and over again, you may not be getting sufficient stimulus to promote an adaptation. And so it's important to gradually progress over time. However, I caveat that with that it is important to consider the concept of regression, so drawing back a little bit, which is also important, particularly when we start experiencing things like cancer-related fatigue, where things may actually you may need to, I suppose, lower how much exercise you're doing on a certain given day with the intention to gradually overall progress over time. And that can fluctuate over time. I guess speaking to the general guidelines proposed by the Clinical Oncology Society of Australia, so it's wonderful to see that COSA has endorsed these type of guidelines and promoting physical activity and exercise and really bringing it to the forefront. Their recommendation, I guess, reflects current Australian physical activity guidelines somewhat, and they're as follows. So all people living with and beyond cancer should return to physical activity as soon as possible following a diagnosis of cancer, within the limits of their condition, their capacity, and overall treatment. Aim to engage in 150 minutes of moderate intensity exercise or 75 minutes of vigorous intensity aerobic exercise per week. So going for a run or going for a walk or going for a bike ride. Importantly, performing resistance training on 2 to 3 non-consecutive days per week at an intensity that's above moderate. And this is important because we want to try and make sure that we are still engaging in some level of strength training. And finally, I guess most importantly, is that exercise needs to be individualized and really tailored to the individual, whether that's they're going through active treatment, whether they're into survivorship, whatever the disease trajectory is and overall clinical health status. The first and foremost is that the exercise should really be tailored to the person. A common question I get asked quite a bit around is, well, how hard should I push myself? And this relates back to the intensity element of the FIT principle that I mentioned before. And often you'll see on social media people are sprinting, they're doing all this absolute sprints on a treadmill, or they're pushing a sled really, really hard and they're completely out of breath. And while I recognize that for certain people, for certain purposes, this may actually be quite useful, the majority of people at a moderate intensity is generally safe and evokes a lot of positive benefits. So one of the ways that we can look at prescribing exercise intensity is via something called the talk test. And what I'm going to pose here is that at a moderate intensity, if you're walking next to someone or running next to someone or cycling next to someone, you should actually be able to hold a conversation with them, and you shouldn't be able to necessarily sing a song. And that's a good benchmark for identifying where a moderate intensity actually is. You can also use rating of perceived exertion, which can vary. There's a scale that goes from 0 to 10, where 0 is very, very light and 10 is extremely difficult. There's also a scale that goes from 6 to 20. And if we had another time, we can certainly discuss that. But if you're looking at using the scale of 0 to 10, aiming for about a 3 to 4 out of 10 will evoke about a moderate intensity. Now, it's important that there's a whole variety of exercise resources actually available, and Exercise and Sports Science Australia have really put together a nice collection of resources that are available. And if you go to exerciseright.com.au, they actually provide some really useful resources. And this is important because, you know, not everyone can access a gym and not everyone has access to the facilities in order to do structured resistance training. So these can be a helpful repository to start with, but certainly the recommendation is if you've still got questions, it's really important that you're engaging with an exercise professional. But it's important to realize that you don't necessarily need to have expensive equipment to have a really good workout. So, for example, no equipment, no worries. So things like using tin food, 1 to 2 litre milk containers, laundry detergent, you know, anything that you can add a weight where you can hold can be an alternative for a barbell for deadlifts, or it can be used as dumbbells. For example, a backpack filled with items you can add extra weight to it, which can be quite useful for doing squats and lunges for resistance training. Multiple stairs, for example, can be useful if you add a weight to it, or even without a weight, can be a good strength and cardiovascular exercise. Filling a laundry basket with clothes can be great if you're doing it correctly, lifting and doing a deadlift maneuver. Using the couch or a chair at home can be quite useful as a bench. And even if you've got a hill sort of near your house, even going up and down the hills can be a great alternative to doing interval-based exercise. And you know, these are just some examples of how we can sort of take common things that we have around the house and use them as strategies to engage with resistance training and exercise. But it is important to note that not everyone will be able to do a lot of these exercises, and it really is important that you're performing exercise in a way that you feel that you can maintain and do it in a very safe way. Before your exercise, though, safety is definitely the priority. So certainly it's important to consider that underlying medical conditions, medications, pre-existing injuries, and things that may actually happen during exercise is important to consider. And particularly as well, if you haven't done physical activity in quite some time, it is important that some level of screening before exercise occurs. And if you're unsure, consulting an exercise professional such as an accredited exercise physiologist or a physiotherapist are great if to actually conduct a lot of these assessments. And of course, your GPs are a fantastic resource as well to talk about if you're starting to engage in a new exercise regime. During exercise as well, your safety is, again, the priority. So if you are experiencing abnormal chest pain, excessive shortness of breath, lightheadedness and dizziness, it is important that you stop in exercise and immediately seeking medical care. And this particular tool is something that you can use, and I've attached a link down the bottom for you to have a look at. But basically, it asks 6 basic questions around medical conditions. If you tick yes to some of these medical conditions, it is recommended that you consult an exercise professional, such as an exercise physiologist or physiotherapist, before commencing exercise. But if no, light to moderate intensity activity or higher is generally advised. Now, some considerations in the context of head and neck cancer. And so I just want to provide these as some general considerations. Of course, it's important that you're consulting with your exercise professional so it gets tailored specifically to your needs. That's important. So weight loss is a particular problem, particularly muscle mass. And so this is why it's really important that we're working with our dietetics colleagues and speech pathology colleagues, as exercise essentially expends energy. And we know that most evidence from head and neck cancer is primarily derived from resistance training. Hence, a focus should also be around aiming to create a muscle building stimulus such as resistance exercise. High levels of cancer-related fatigue. So interestingly enough, exercise actually can be a tool to manage cancer-related fatigue. However, we need to be strategic here and importantly understand that the exercise needs to be individualized, and on days where fatigue is quite a problem, even doing small basic exercise might be useful. But on days where you're feeling a little bit less fatigued, you may wish to consider increasing the intensity or the amount of exercise that you're doing. Ultimately, it's important to listen to your fatigue and recognize there's going to be days where you're going to be able to do more and also days where you're going to be able to do less. Dry mouth and throat is often the most reported barrier to exercise for people with head and neck cancer. And for this, it's important to manage fluids and even avoid things like exercising in the cold air, which can help minimize this. Low blood pressure that doesn't seem to fluctuate with changes in posture. And this is often associated with some of the radiation treatments that happen and may remain persistent for months after treatment. And it's important that you are keeping an eye on your blood pressure, as exercise will increase it during exercise, but afterwards it may actually decrease it. So it's important to monitor things like lightheadedness. Inner ear balance issues as well, which can increase the risk of falls. Peripheral neuropathy, which some of you may or may not have heard of, which is typically brought on by some of the chemotherapies that are used. And this alters the sensations in your hands and feet, which might make gripping things a little bit more painful and just uncomfortable, as well as this might impact on your overall balance and pain when walking. So it's important that when you're doing exercise and you're working with a health professional, that you're letting them know about these sorts of things so that the exercise can be modified. Infection risk as well. So if you do have a fever or you do have fever-like symptoms, it's really important that you're not engaging in exercise and seeking medical care as soon as possible. Musculoskeletal concerns, such as pain, musculoskeletal concerns and pain, I should say, so around the shoulders and cervical spine, top of the spine and the middle of the spine, particularly after surgery, and things like medications, like some of the strong pain relief medications may actually cause issues with balance, which may increase the risk of falls. Lymphedema is quite a significant problem as well, and you certainly may have heard that exercise does have benefits here. However, it's important in this context that you're consulting a specialist lymphedema therapist around the precautions for exercise, as they'll be able to provide more advice around range of motion exercises around the neck and also some deep abdominal breathing. Whether there's a feeding tube, so it's important to ensure that the incision is completely healed and that there's medical clearance given for exercise. As well, when you are working with someone that is an exercise professional, they may start cueing you around how we can try and minimize the amount of pressure within your abdomen by particularly with resistance exercises. So you're not holding your breath when you're doing exercise, and we'll be able to help you manage this. And finally, cardiovascular disease and risk factors. So it is important to know that if you do have underlying cardiac-related conditions, that we are able to prescribe exercise in a way that's safe. So finally, it brings me to the end of the conversation, and I just wanted to talk about a brief case study on John, who was a 60-year-old male who had squamous cell carcinoma in the tonsils and required, and it recurred in his neck nodule. When I saw him, he didn't have metastatic disease, and when I saw him, he wasn't currently undergoing active treatment, but he had in the past had surgery, chemotherapy, and radiotherapy. And one of the big issues that he encountered was significant weight loss. And he also had some cardiovascular disease that he had to manage. Regarding the considerations for exercise, things that we discussed about and then we took into account with the exercise prescription included things like energy intake was a big one. And this is where we collaborated with a fantastic dietitian to ensure that energy balance was maintained. In order to, I guess, to help with the weight loss, well, not help weight loss, but try and improve his weight overall, our goal was very centered around trying to improve his muscle mass. So resistance training was a key modality of exercise. Because of one of the medications he was on, his heart rate was blunted. And so we were using the perceived exertion scale that I was talking about before. And we were also monitoring his blood pressure response because he often reported he may have episodes of dizziness. Regarding the exercise prescription, we commenced multimodal exercise, so both aerobic and resistance training on 2 days per week. And we eventually increased that to 3 days per week over a period of 12 weeks. where we had 2 supervised sessions with myself and 1 home-based session. John preferred supervised exercise, but there was a cost associated with that, and so hence why the home-based session was employed. He loved resistance exercise, which was wonderful, and wasn't a huge fan of long aerobic exercise. But what we eventually did was separated the aerobic exercise to be conducted at home, and the resistance session was to be conducted with me in the clinic. With the aerobic exercise, when he was doing exercise, he wanted to typically work at a slightly higher intensity. So the goal was to try and aim to achieve 75 minutes of vigorous exercise per week. And during his home-based walking, he dedicated 20-minute sessions, and that was his home program. One of the techniques that we looked at was doing small bursts throughout the day. And so over the course of the day, we try to accumulate 10 minutes a day of these small 1 to 2 minute intervals throughout the day at that rating of perceived exertion around 13 to 15, which corresponds to that sort of 4 to 6 out of 10 that I mentioned before. With the resistance training, this was John's favorite part of the week. So full body exercises were recommended, and we started off at 6 and progressed that all the way to 8 at a moderate to vigorous intensity, starting a little bit lower and making it a little bit harder over the period of time. And the way that we started to challenge things and the way that we started to look at it, trying to improve muscle mass, was we changed, over time, some of the tempos associated with lifting weights. So trying to slow down the weight lifting movement to create a bit more of a stimulus to assist with muscle growth. Just at the end of everything, I just want to acknowledge the fantastic Flinders exercise physiology team that I'm incredibly lucky to work with here at Flinders University. And to also acknowledge that if you are in Adelaide, Flinders University has a Health to Go exercise physiology clinic that's run at Flinders University Bedford Park. It's a student-led clinic, and if you want any more information, please go to the website, call, or feel free to email myself. But thank you.
Thanks, Matthew. We were going to do some questions, but we've gone a bit over time. So I just did want to, hopefully we'll get to them at the end, but we'll see how we go. But I did want to make sure that Anna and Paul got their opportunity to speak. So thank you for a very comprehensive presentation, and also giving a lot of practical tips there, food for thought. So hopefully we'll get back to some questions, but we will pass over to Anna, who's waiting in the wings there. Anna, I'll just give you a quick a little brief bio of Anna. Anna Boffinger is, as I said earlier, a former patient, and she's from the Sunshine Coast in Queensland. Anna was a fit and healthy 53-year-old when she was diagnosed with tongue cancer in 2020. She underwent surgery and 6 weeks of radiotherapy, and Anna's personal experience, both as a patient and as a physiotherapist, has given her an intimate knowledge of the challenges that head and neck cancer patients face. And she's passionate about improving the pathways for others, especially with regard to rehabilitation, to give people a better quality of life during treatment, recovery, and beyond. So really looking forward to hearing your story, Anna.
Thanks, Kelly, very much for that introduction, and good morning to everyone. Good morning to everyone who's joined this webinar, and also a big thanks to Nadia at Head and Neck Cancer Australia for the opportunity to be part of this important topic. As Kelly mentioned, I'm a former patient. I'm hoping that by sharing my patient experience, I can add to that great lot of information that Matt provided, and that you can take away some useful and practical tips to help your recovery or the recovery of someone close to you. As any patient undergoing the treatment for head and neck cancer will attest, the treatment and its side effects are often brutal, and the physical recovery can be extremely challenging. Personally, I found the months after treatment had finished the hardest. Exercise played a key role for me during this time, and it remains an important part of my life now, as it did before my diagnosis. So I would encourage you to use exercise as medicine, and it can be a valuable companion to your treatment. And for me, it allowed me to shift my focus from one of illness to one of wellness. As Kelly mentioned in the introduction, in 2020, about 3 years ago, I was diagnosed with tongue cancer. I was fit, healthy, working full-time as a physiotherapist and managing a small business. My treatment commenced pretty well within 2 or 3 weeks of my diagnosis. And you'll see there, my initial treatment was surgery, followed by 6 weeks of radiotherapy at about 5 weeks post-op. So just touching on what Matt had said, in an ideal world, there would be prehab or some kind of rehabilitation or input before treatment, but often with head and neck cancer patients, there's a very short time frame between diagnosis and treatment. So this isn't often possible. Second slide, please, if you don't mind. Although I'm fit and healthy now, it's not to say I didn't face challenges in my recovery, which I'm sure as a patient you can relate to. I experienced significant weight loss, extreme fatigue and poor stamina, a lack of motivation, and I felt somewhat overwhelmed by the situation I was in, even though I'm in the medical profession myself. I had lost muscle mass and my pre-diagnosis level of strength and fitness. At my lowest point, I was unable to exercise for about a month after finishing treatment, and even simple things like taking a shower were an effort, and I'd find myself needing to lie down or sleep to recover. But from that point, I slowly set about rebuilding my fitness. And so in the next few slides, I'm going to outline the approach I took to exercise. Next slide, please. I'm going to talk more about just general exercise rather than the specific rehab that I needed to do. So in general terms, I followed a walking program as the cardiovascular component of my fitness. I was able to do this after surgery, and I continued walking daily for 60 minutes, about 5 kilometres during my period of radiation, so for another 6 weeks. If you don't mind moving on to the next slide. As I mentioned before, for about 4 weeks after I completed treatment, I couldn't exercise due to the side effects I was going through, and really just getting through the activities of daily living was an effort. About 1 month post-treatment, I was able to restart a graduated walking program. At 3 months post-treatment, I added in an individualised strength program, and I did this under the guidance of an exercise physiologist. I then progressed to small group exercise, which is under the guidance of a physio, and with my walking program, I added in longer distances and then more challenging things like hills. Next slide, please. I just put that up to show a bit of a time frame of the things that I got back to doing. Obviously, these things were a big motivation for me because they're things I enjoyed doing prior to my cancer diagnosis. And most recently, at the beginning of this year, I did the South Coast Track in Tasmania, which is about 8 days walking over quite rough terrain. And last slide, thanks. So here I've listed some practical tips that helped me during my recovery, and I hope that you find these helpful. Firstly, for me, understanding why exercise is important was a big motivator. And just building on what Matt said, that we know exercise is good for general health, but it also plays a vital role in cancer care, and probably an unutilised role or underutilised role. The role in cancer care is strongly supported by evidence, and the research in this area is growing all the time. So again, thank you to Matt for the information he's provided, but just to reinforce that, we know that exercise has the potential to reduce the side effects of treatment and allow you to cope better with your treatment. It has a role in reducing the risk of cancer recurrence, although, as Matt said, most of this research has been done in breast, bowel, or prostate cancer patients. Exercise reduces cancer-related fatigue, and we know it also affects other body systems in a positive way. It can boost the immune system, it can help improve mood, it's beneficial for your bone density, it's important for heart health, and it can be used for stress management. A second practical tip, you need to include both cardiovascular and strength components to your program. Your program needs to be personalised and targeted, just like the other areas of your treatment. So I'd recommend you seek out the help of an experienced physiotherapist or exercise physiologist to take baseline measures, help devise and progress your program. You may have other health conditions that need to be considered, as well as your pre-diagnosis level of fitness. The quality of the exercise you undertake is also important. For me, an important thing was an exercise partner. This helped me greatly with my motivation and accountability, and I'm very grateful to my family and friends for their part in this. There were definitely days when it would have been much easier to not exercise and just lie on the bed, but I always felt better for getting outside and doing exercise. Also consider small group exercise when appropriate, because you get the additional benefit of a support network. I would also recommend using a smartwatch and keeping an exercise diary, which you can use to monitor your activity. You can record things such as distance walked, the time taken, your heart rate during activity, your response to the activity, and if you're undertaking a strength program, recording the exercises you're doing, the sets, the reps, and the weight. Use realistic goals as a focus, or some sort of activity you want to get back to, and work in blocks of 12 weeks to see your improvement in fitness and strength. For me, it was also important to connect with nature. And if you're interested, you can read more. The work of Dr. Quinn Lee, who's an expert in forest medicine and immunology. Consistency is key, but also pacing is important, and allowing yourself time for rest and recovery. And lastly, exercise should invigorate you and not wear you out. So consider it as part of your treatment regime. Hope that's provided some helpful tips for you today. Back to you, Kelly.
Thank you so much, Anna. That's thank you for sharing your story, your own personal story, and you gave some really, I think, helpful for people on the webinar and those that will be watching, some really good insights, but also some practical tips of what worked for you. So thank you for doing that. And I do love your slides. Your beautiful slides behind you in that presentation were wonderful, and you felt calm just looking at them. So so thank you for sharing your story. Again, I might just keep going so that we can get to Paul, and hopefully we will be able to come back, because I think there might be a few questions that will come up. So I'll move right on to Paul. Paul Mowbray, who is a former patient from Wagga Wagga, New South Wales. So we're sort of spreading it far and wide. I'm not quite sure where Paul's coming from today, but I know he's out fishing somewhere, so he might share that in a minute. But Paul was a 58-year-old high school teacher when he was diagnosed with HPV-related head and neck cancer in 2017. Paul finished treatment in 2018 and is now enjoying his retirement, spending as much time as he can out on the water. fishing. He's looking forward to sharing his approach and his personal experience around exercise, both before, during and after treatment. So he's hoping to be able to help others by sharing his story. And we're really pleased he's agreed to stay on dry land for an hour or so while he's to come and join us today. So I'm going to perhaps ask a few questions of Paul, and he's going to be able to tell us his story. So thanks for joining us, Paul, on your break and your holiday. So I guess I just wanted to start by perhaps you could, I know I gave a little bit of insight into who you are, but perhaps you could tell us a bit more about yourself, if there's anything more you want to share, and what type of, I know what type of cancer you were treated for would be helpful to start with.
Yep. Thank you very much. And gee, I wish I had all that information when I got started. It would have been handy. But yeah, 2017, I found a lump in my neck, and it ended up being back of tongue cancer. I went round because I was in Wagga, and they didn't have a whole lot of idea about what to do with it there. So I ended up going to Canberra and then to Wollongong, and then I ended up at the Chris O'Brien Lifehouse in Sydney. And from Wagga, where they said, "Oh, sorry," and I was given a 45% chance of survival, to Sydney, where, "Oh, we can cure this." It was a different story, and I'm so glad I ended up at the Chris O'Brien Lifehouse, because they were fantastic. They knew what to do, and they were just brilliant to me, and they gave me lots more advice and things. Yeah, so I'm just grateful for that. Certainly, I had some speed bumps along the way. I had a feeding peg. It was infected nearly the whole time, and that was one of the things that, you know, I guess slowed me down as far as exercise goes. But anyway.
So Paul, did you were you one of these people who was a regular exercise before your diagnosis, or were you someone who had to almost discover it once you were diagnosed?
No, I was a teacher. I was reasonably fit. I played golf a couple of times a week. I water skied, snow skied, and I would say I was reasonably fit for my age. But yeah, once I was diagnosed, I must admit, I was too busy trying to figure out what the heck was going to happen to me and where I was going to get treated. So exercise pretty much went out the window, and I was just trying to find out what was going to happen next.
Understandably, with all that going around and being told one thing, that, you know, lower survival rate, and then being told cure, that must have been such an emotional roller coaster for you as well. So okay, you've now been diagnosed, and you're having your treatment. So how did you go about organising your exercise rate, if you want to call it regime or plan or program, during that time? How did you talk to? I mean, some of the things that Anna was talking about, and even Matt, was that resonating with you? Was that your experience?
It certainly was, but I was sort of a bit different in that we moved away from home. We went to Sydney for 3 months.
Yeah.
We hired a unit really close to the hospital, which ended up being a brilliant idea. And I just walked up 300 metres to treatment each day to have radiation and chemo once a week, or radiation every day and chemo once a week. But I did speak to the multidisciplinary team. There were dietitians, exercise people, all sorts of people, and they just said, do as much exercise as you can. So I did. I walked. I bought a really big, ugly hat to try and, because they said, don't get your neck sunburnt. So I bought this big hat, and I walked through the university at Sydney down to Broadway. I walked as much as I possibly could. But again, as I said, I had an infected feeding tube, and that sort of slowed me down. By the 15th fraction of radiation, I was pretty slow. I was pretty dopey. I just wanted to walk up, have my treatment, and go back to the unit and not do much. By the 25th fraction of training, I was flat out walking up to the hospital. And I think my wife was holding my arm to make sure I got there. And then by the 28th fraction, I ended up in hospital for nearly 3 weeks. So there was not much exercise happening there at all. I guess as I did get better after treatment finished, I was in hospital for 3.5 weeks after treatment. I just started walking around the hospital ward to start with, and then gradually built it up. One of the physios said, you know, for exercise, they said, breathe through your nose and out through your mouth. That's about as much as you can do. So, but yeah, deep breathing was pretty important to me. When I got home, it was a different kettle of fish. I got home and I started walking. I have grandchildren that I was trying to look after, but they were looking after me, I think. But as time went on, I got to the point where I was riding a push bike around the lake. I got to walk. With a friend who'd had a heart attack. So the pair of us were, you know, golfing buddies. We did that. That was pretty handy. I did buy myself one of those gym fit machines, and I gradually got stronger and stronger and better and better. And if there's anyone out there with anyone, you do get better. It takes time. The dry throat goes away after a while, but you do get better, you do get stronger. And within a year, I walked the equivalent of Wagga to the Chris O'Brien Lifehouse as a fundraiser for them. And I actually clocked up 655 Ks for the month of August. So you do get better, you do get stronger, and yeah, there's light at the end of the tunnel.
A very good message, Paul. And I think what you were saying also picks up a little bit. I think both Anna and Matt mentioned this notion of keeping motivated. One of what you're saying is take it slowly, do what you can, and
don't beat yourself up. Don't beat yourself up if you don't feel like doing it, because there'll be times where you don't want to do anything.
Yeah. And even anything is better than nothing. I think that was coming through too. Even though the guidelines say that you can get to that, but anything is better than nothing. And also I was hearing from your story, Paul, that there were some motivators. One being obviously the grandkids, because they're probably got to be, and so you're giving a bit of motivation there. And also your buddy who was also having to do exercise after a heart attack and who you knew. So can you just talk quickly a little bit about that motivation? And was that just physical, or that also help you mentally and emotionally?
I think mentally, if you're outside, you feel better. And if you're outside exercising, you feel better. I put headphones on, listened to podcasts, and just walked and walked and walked. But I did go to, I was having problems with my jaws and things like that. And I went to an exercise physiotherapist. And they gave me, I was getting sore necks. They gave me specific exercises for my head. So I took their advice, and listening to them and following those specific exercises. Some of them were just putting my tongue and pushing it against the inside of my mouth and holding it, like little things that I would never have thought of doing. But those specific exercises really helped with jaw pain that I was having and sharp shooting pain. So it was, the experts know. So yeah, listen to them and get as much advice as you can, I guess, is my suggestion.
And any other last advice you've got, Paul? I mean, you've outlined a few, but what are some key things for you that helped you to get through that? As you said, it's for some it's slow. The process is slow, but look where you are now. So what's some of the perhaps some tips or some advice for people who are on the call, on the webinar today?
Well, my dentist told me about the specific physiotherapist who dealt with head and neck. And I'd been going to a different physiotherapist who hadn't helped, but this one was a specific one. So finding the right physiotherapist who specializes in that, and my dentist put me onto that. So dentists, are very good because they help find my problem. And yeah, so I would say find the right person.
That's a great tip. I don't think that's come up today, but thank you, Paul, and thank you so much for joining us. It's great to see you looking so fit and healthy today. So that's been terrific. So thank you. I think we've got 5 or so minutes, or 8 minutes or so. Nadia will keep me on track. Just to perhaps, if I bring all our speakers back on, and we can address some of the questions that have come through. I think I'll just do the one that we've got in here, and then I'll go back to some for Matt. I've got a question here. I think it's probably for Matt, and it might have been addressed. Is there benefit? It's a good question. Is there benefit in allowing clients to spread exercises throughout the day if they can't form them in a block?
Yes. So what we're starting to see now is this concept of even small bouts of exercise which is performed at a sort of a vigorous intensity, and as little as sort of 3 to 4 minute sort of blocks can be quite helpful from improving cardiorespiratory fitness, helping with controlling blood sugar as well. There was actually something that was recently came out of the University of Sydney, actually, that was sort of showing that even these small bouts can be quite useful to mitigate the risk of developing some cancers. So it sort of shows you that, like, it's important that exercise is individualized as much as possible, and even doing small amounts cumulatively through the day. The term they use is exercise snacking. Short bouts throughout the day, not to be confused with eating, as I've correctly been pointed out before, can be quite a helpful strategy to accumulate overall total volume of exercise. I think it's quite useful as well, particularly during treatment, as Paul was mentioning. Like, there's going to be days that just absolutely hit you for six, and doing these small things could be useful where it's possible, knowing that there may be some benefit associated with it.
Yep. Great. Thanks, Matt. We haven't got anyone else got any questions. Please pop them in the chat. But I was just actually going to ask Anna a question. How has your experience as a patient influenced or impacted on your role as a physio? And is that changed or impacted on the way you approach patients? I don't know if you've seen any with head and neck cancers, but is that changed in any way?
So I don't work in the area of cancer care myself, but my experience certainly opened my eyes on so many levels. And particularly for head and neck cancer, you realise the treatment doesn't just affect a local area in the body. It mightn't be just where you're having or had the treatment. You get systemic or whole body effects, which need addressing. And so that was probably one thing. And the fact that even when your treatment is finished, you're still dealing with the effects. You know, it doesn't mean, if you like, the cancer is over. You're still needing to recover, and that can be quite a varying time frame from patient to patient, because the response to treatment is very individualistic. Yeah, so they were probably the biggest things for me, just understanding more. Even though I'm a health professional, I really had very little experience with patients with cancer. So that's my perspective.
Thank you. Thanks, Anna, for that. I just thought that would be interesting. We do have one here for you, Paul. Was your jaw pain first bite syndrome, or a hurt consistently with eating or talking, or just at rest? Or hurt consistently with eating or talking, or just at rest? Oh, jaw pain. What kind of jaw pain? Yeah.
I found that when I go to eat something, if I opened my mouth too wide, I'd get a really sharp pain down the down the side of the throat, from the ear. I did find that doing the exercises using my tongue, pushing against it, really did help that. And even now, 6 years later, if I haven't done my exercises for a while and I go to eat something big, I can still get that. So I do my exercises and fixes it.
Thanks, Paul. I think we're nearly out of time, but I just, there's a couple here, Matt, I think that came through prior, some of which I think you've already covered. I think this one was relating to neck and jaw cramps. So you're able to answer the one around, I suffer from neck and jaw cramps a lot 2 years after the radiation treatment was completed. Is this normal as a side effect? I'm not sure if you're able to answer that one.
Probably a little bit out of my scope, but certainly it's a common thing that I've seen particularly after radiation treatment, that people get that sort of locked jaw. And I guess with this, where Paul was sort of mentioning around the concept that there are exercises that can assist with managing that, but finding the right person to actually talk about and deliver those types of exercises is really critical.
Yeah, right.
Sorry.
Yeah.
Sorry, Kelly. I just saw a question from Leanne, who's a dietitian down in Tassie, and asking whether the webinar will be available on our website. So yes, we have recorded it, and it will be available under the health and wellbeing section on the website, and on our YouTube channel.
Great, thanks, Nadia. Is there any other questions? I mean, I think most of the ones that came through, unless someone feels we haven't answered it. I mean, some of the questions are very specific, which are not within particularly Matt's remit. So the only other quick one I was just looking at, I guess it was picking up on the physiotherapist role, but I think we've kind of covered that, although the difference between exercise physiologists and physios, probably for another time, but that I'm not sure how if that was the question, or whether the role of the physio in exercise might have been the question.
I think like we have very synergistic pathways. There's certain things that we both sort of align with quite a lot. I think there's certain things that physiotherapists can do that are specialty in this particular area. But I think first and foremost, we're both exercise professionals that are using exercise as a medicine, and both have that level of university training that's designed to go, if someone comes to us, we can use exercise in a very targeted way to improve their outcomes. So I think we sort of collaborate and integrate really nicely as professions.
Right. Thanks, Matt. All right, Nadia, I think we might need to finish, unless there's anything else that, I think we probably need to finish there. Yeah. All right. Well, thank you so much to our speakers. That was really insightful, and a great mix of personal experience and professional, and bringing that together, and very, I think, on the same page, really, and many of the same messages coming through, and some fantastic practical tips. So thank you very much for being with us today, and for presenting, and for everybody who's been online, and for your questions, although I think there is another couple coming in through now. I think people just responding to the exercise physiology questions, so it's more comments. But I just wanted to remind everyone that there are lots of resources on the HANCA website for you, so please make sure you make use of those. And as Paul said, if only he had that information himself. So depending on where you are on your journey, please go to the website. There are so many different fact sheets, animations, podcasts, videos, you name it, on just about every topic you can imagine. And as Nadia said, the previous webinars are there, plus this one will be going up as well. And we will be providing a webinar link for a survey, just to email, that will be emailed to you to get some feedback, so that we can continue to make these webinars as helpful and as informative to you as possible. I think that's all from me, Nadia. So do we pass back to you? Or
no, you're doing such a great job, Kelly. Thank you.
Well, thanks again to everybody, and wish you a very happy day.
Thanks, everyone.
Bye.
See you next time.
Bye.